The information set out here provides a generalised guide to total hip replacement surgery. The risks and benefits of treatment vary from patient to patient and must be carefully discussed with your surgeon. It's important you understand how surgery can help you, what will be involved, how a possible complication may affect you, and what alternatives there are. Hip replacement surgery is a highly effective treatment for pain due to advanced hip disease. Usually, this is due to osteoarthritis. Hip replacement surgery should only be considered when symptoms have a substantial impact on quality of life and have not been helped by non-surgical treatments. The threshold for surgery depends on the level of pain, the patient's age, their health and functional requirements. Whilst many patients who opt for surgery will have suffered from fairly constant pain and reduced mobility, there is not a fixed level of discomfort or disability an individual must reach before being bad enough to justify an operation. People vary greatly in their tolerances of pain, their attitudes to disability, and their feelings about having surgery. Whilst a surgeon can advise, the decision to go ahead with the operation is for the patient to make. It is worth bearing in mind that the recovery from surgery tends to be easier and more complete if surgery is not left too late, when the muscles around the hip will have become stiffened and weak. For many people, surgery is not required, and a combination of weight loss, activity modification and painkillers may be all that is needed. It is of course the case that many people with arthritis find it difficult to lose weight. Similarly, although sometimes helpful, long-term painkillers may cause side effects, and there are some risks that should be discussed with your family doctor. Physiotherapy and a moderate non-impact exercise program can help to strengthen the muscles around the hip that are often weak and stiff. Some patients may find a walking stick to be helpful. A steroid injection into the hip joint can sometimes also be helpful, though the benefit only tends to last for a few months. Whilst for some, such measures are all that is required, for others with more severe disease, hip replacement surgery may be more effective. Total hip replacement surgery involves the replacement of the femoral head and pelvic socket. The operation usually takes between 60 to 90 minutes. After the worn-out head is removed, a replacement metal or ceramic ball is then attached to the femur using a metal stem. The socket is then cleared of worn cartilage and a small amount of bone, and the cup is inserted. Total hip replacements may be fixed into position using either a bone cement or a surface treatment onto which bone grows. The decision as to which form of replacement is most appropriate depends on the patient's age, their activity levels, the strength and shape of the bone. As with all surgery, there are risks, though generally hip replacement surgery is considered to be safe and reliable. Some of the complications seen after hip replacement surgery are risks that patients undergoing any form of major surgery are potentially exposed to. Surgical techniques have evolved to minimize the amount of blood loss during and after surgery, and blood transfusion is now uncommon. Patients with anemia or those unable to stop blood-thinning medications are at a higher risk of significant blood loss during surgery and the subsequent requirement for transfusion. Infection may occur within the hip joint. This usually causes pain and may make the patient unwell. The risk of this occurring is approximately 1 to 2%. If a hip replacement becomes infected, a prolonged course of antibiotics together with further surgery, including the removal of the implant, is required. There is also a small risk of developing infection elsewhere in the body after surgery, such as in the chest or bladder. A blood clot or deep vein thrombosis may cause pain or swelling in the leg, and the veins may become distended. The risk of this occurring is approximately 1 in 40. As some swelling is normal after the operation, it can be difficult to tell whether a blood clot is present and a scan may be needed to check. If a thrombosis does form, it will be necessary to take a prolonged course of blood thinning tablets. Some patients who suffer from deep vein thrombosis go on to develop long-term problems including persistent pain, skin discoloration, varicose veins or ulcers. We try to minimize the risk of blood clots by getting patients up on their feet and walking soon after the surgery. Other measures we take include the use of anticoagulant medications and calf compression stockings. If a blood clot forms in the legs or pelvis and then travels through the circulation to the lungs, this is known as an embolism. The risk of this is approximately 1 in 250. Symptoms may include shortness of breath, chest pain, or coughing up blood. A pulmonary embolism is a serious and potentially fatal complication. Patients with symptoms suggestive of this should attend an emergency department immediately. A heart attack or stroke may be precipitated by hip replacement surgery and could potentially cause death or long-term disability. Occasionally, it is difficult or impossible to pass urine immediately after surgery. In such situations, it will be necessary for a catheter to be passed into the bladder. A fracture may occur during the insertion of the hip replacement. The risk of this happening is approximately 1 in 50. Usually, this complication is managed by the surgeon placing wires around the fractured bone or using a different type of prosthesis. If such a complication does occur, it may be necessary to walk using crutches for a longer period of time than is usual. The risk of hip dislocation is approximately 2 in 100. The physiotherapy team will carefully explain how this risk can be minimized. Approximately 1/3 of patients who suffer from hip dislocations do require further surgery. During surgery, sometimes it is not possible to equalize the leg lengths, and occasionally a small shoe raise may be required after the operation. Very rarely, damage to the larger blood vessels around the hip joint may stop the circulation of blood to the leg. This would require further emergency surgery, though is seen in less than 1 in 1,000 cases. During hip replacement surgery, the nerves that supply the leg and foot may become damaged. This can cause weakness or numbness in the leg or foot and has a reported incidence of approximately 1 in 100 cases. Usually, nerve function tends to improve with time, though occasionally the damage can be permanent. Most hip replacements can be expected to last for over 20 years. In perhaps 1 in 20 patients, unfortunately the hip replacement needs to be performed again within the first 10 years. The process of recovery following hip replacement surgery is quite variable. Most patients will be able to take a few steps on the day of surgery or the morning after. Most patients tend to stay in hospital for 3 nights and report significant improvements in their pain, function, and mobility within the first 4 weeks following surgery. Usually it is not recommended to drive until 6 weeks have passed. As the tissues take approximately 3 months to heal properly around the hip, during this period it is necessary to adopt certain precautions in order to minimize the risk of dislocation. It is important to be in the very best possible physical condition before the surgery. Long-term health conditions such as diabetes or high blood pressure should be carefully checked and controlled prior to surgery. Smoking should be stopped and alcohol intake should ideally be minimized in the month or so preceding surgery. Patients should adopt a healthy, balanced diet and take gentle exercise in order to maintain muscle control and strength, which will facilitate early recovery of function. In summary, although a detailed review of the potential risks of hip replacement surgery may seem daunting, it must be remembered that most patients go through the operation without any problems and report excellent levels of satisfaction following the procedure.